We begin with the latest on abortion. Health and Human Services Secretary Xavier Becerra holding a press conference just a bit ago to discuss the Biden administration's response to last week's Supreme Court decision overturning Roe v. Wade.
HHS has been preparing for this for some time. That's why earlier this year, we launched our HHS Reproductive Access Task Force to plan for every action necessary to protect women's access to reproductive health care. There is no magic bullet, but if there is something we can do, we will find it, and we will do it at HHS.
And for more on this, ABC News senior national policy correspondent Ann Flaherty joining me now to discuss. So, Ann, just kind of help us understand here how HHS and Biden and this action plan actually assists women in states where abortion is currently illegal.
Well, you know, you heard from the Secretary Becerra. He said there's not a lot that he can do. There is no magic bullet to respond to this, but he hinted that there could be some more things to come. You know, we know that telehealth medicine, for example, is available in some states. He mentioned that. He mentioned that the medication abortion is widely available in states like California and New York. The question, though, is, of course, how do you get it to women in states like Arkansas and South Dakota that are banning this? And he acknowledged there is no loophole here that we can exploit. So what he was trying to achieve today was giving the American public some basic facts about going to abortionfinder.org is one site that you can look at and see what your options are. He talked about wanting to make sure that people know that if you are on Medicaid, which is a very large insurance plan funded by the government, that there are exceptions for rape and incest, for example, even though some states do not include those exceptions. So, you know, he told us to stay tuned. This is not going, progressives aren't going to be happy with this. They wanted to hear more today. But he says that they're still working on this. They want to be on solid legal ground.
All right. So how much of what Becerra said, though, is actually existing policy? And does what he say change anything?
So, Kara, almost everything that he mentioned today was existing policy, but it's a question of whether or not the government can enforce it. So, for example, under Medicaid, as I mentioned, it would cover abortion in cases of rape and incest. So if you're living in Arkansas and you're denied that care, it's possible that the federal government will try to defend a person who has been denied that exception. You know, but everything else that he mentioned, he talked about wanting to ensure that people have access to contraceptives. He talked about family planning and making sure that CMS, which is the federal agency that regulates healthcare providers, that they have what they need to make sure that Americans have access to family planning services. These are things that have always existed. That doesn't change anything right now. He did hint at something related to the FDA, that the FDA might consider expanding access to mifepristone, but we don't have those details. So not a lot to hang on to just yet. We're still trying to sort through those details. I think what this shows us is how legally complex this is and how careful the administration wants to be on this.
So Becerra also says he will direct the Center for Medicare and Medicaid Services to take every legal available step to protect family planning care. So what would those options actually be?
Well, I think one of the things that they're talking about is making sure that people have access to Plan B. So there's a lot of misinformation out there. People seem to confuse Plan B with the abortion pill. Plan B is something that you take after protected sex to prevent a pregnancy. It is not something that causes an abortion. This is different than the abortion pill. This is something that they want to make sure that families have access to, people have access to, because they consider that an important preventative measure. You know, I think that they're going to be trying to increase the resources that federal government puts towards these family planning services. But really, their hands are tied on so many of these points. I mean, there's only so much you can do when you run into conflict with state law. So a lot of this is going to still end up in the courts when it comes to anything related to abortion outside of contraception.
All right, Ann Flaherty will be talking a lot about this for sure, especially as we start moving toward the ballot box. Thanks, Ann.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.